Jay, welcome to San Antonio, and I'm looking forward to talking to you about the use of SAA in bone injury versus bone infection. Can you tell us about a couple cases, or?
So treating foals, very often they get into a little trouble and they get bumps and bruises. And very often I'll be presented with a foal that the client has noticed has a swelling on a limb, and there will be a little reaction on x-ray, and trying to differentiate whether or not it's just trauma or whether or not there's an underlying infection can sometimes be a little bit of a gray zone.
So the first thing you do, you radiograph?
First I'll do my physical exam.
Right.
You know, look for lameness, pain on palpation, take a temperature, look over the foal for any other signs of abnormalities, just so there's not a lot of confusion when you're looking at blood work with foals.
Right.
But then I will x-ray and I will do white count and SAA.
Okay. And that's been able to tell you what in these cases specifically?
So if the SAA is less than 50, I'm fairly confident that it is not an infectious cause. If it's greater than 50, I'm fairly confident that it is an infectious cause, especially if there's no other physical abnormalities on the foal. Sometimes that white count can really be a little bit misleading. Some foals will have minor elevations of white count, where if I didn't have that SAA, I might not have the confidence to say, no, we don't need to treat this one with antibiotics.
Do you think you need the white count still?
I would still, because for me, it's also something that I follow along for treatment progression, as well as the SAA.
Okay. So when you look at these foals with these injuries, if you have a borderline SAA number, if you have a 30, you have a bump on the leg, you have a lame or not lame foal, depending, what do you do? What do you do the next day?
Well, that'd be a conversation with the client, of course. And if they are content to let it go for 12 to 24 hours, then I can come back and do a serial SAA on them at that time. But of course, if the client is a little cautious or a little nervous, then we'll go ahead and treat them with antibiotics if we're in that gray zone. Do
you have a feeling about, if you could choose your case, would you go the next day and test them all? Is that judicious? Usually the first time is going to work, especially if you're going to have a change on the x-ray already. If you're already seeing a change on that bone, then the process has been going on long enough that your SAA is probably going to be pretty realistic the first time. Right. And in the end, how has that helped you with the use of antibiotics in your practice? It's cut down the use of antibiotics in foals, which is something near and dear to my heart and that of my clients as well. I agree. Foals, adult horses, we're all looking for that. That's a great take-home message for everybody, and I really appreciate you coming here and giving us that insight. Thank you. Thank you.